Hi, I'm Dr. Noelle Lucas from Blue Oasis Pet Hospital, and I'm here to answer some questions that you have about dog anesthesia, especially the risks that are associated with it. So I have an assistant that's going to ask me a few questions.
Dr. Lucas, what are some of the risks and side effects of dog anesthesia?
So general anesthesia in your dog does carry risks, and that actually is one of the main concerns that pet parents have, especially the hesitation that clients have with moving forward with anesthesia is, I'm worried about the risks. So let's talk about them. So risks are real. We can't take away all risks when we go under general anesthesia, but we can really mitigate the safeties. But what are some of the risks? So risk would be having an uncontrolled airway. So that's why we intubate dogs when they go under general anesthesia. Risk of abnormal heart rate and rhythm. So heart rate drops too low, or they have arrhythmias that would come about during general anesthesia. So we try to use medications that help keep their heart rates up. And we also do ECGs prior to anesthesia, especially in our older pets, usually 6 to 7 and older. We're going to do an ECG on your dog if they'll allow it, depending on their fear, anxiety, and stress. We're going to listen to their hearts because we want to, again, hearts are really important when we're under general anesthesia. If your dog has heart disease, sometimes we'll already have taken chest x-rays or done an ultrasound to try to determine what stage of heart disease they're in and how much risk they might have. We do partner with a telemedicine service when we do our ECG, so we're having a cardiologist look over those hearts to help mitigate risk because we want to know that they have looked at that dog's heart and say it's okay to go under general anesthesia. We have risk of getting too cold, so we have a hot dog. It's called a hot dog blanket to try to keep them warm or rewarm them if they get a little bit cold. We're watching perfusion and blood flow, so that's blood pressure risk of dropping too low. So we've got blood pressure monitors, we use IV catheters, we use IV fluids during the procedure to help kidney function and perfusion. So lots of different risks associated with general anesthesia. We can't mitigate all of them, but we do a really good job in our training and some of the safety features that we have in our hospital to try to, as much as we can, mitigate those risks and keep your pet really safe under anesthesia. Another thing that we do here that is unique to Blue Oasis is we know that anesthesia is such a big worry for pet parents that we allow you to stay with your pet while they're here for any anesthetic reason, so that you can be with them before they go under anesthesia. You can even watch what we're doing with them during their anesthetic time, and you can be here with them afterwards. So that can give you a lot of peace of mind when your pet goes under anesthesia.
Are there certain conditions that increase my dog's risk of reaction during anesthesia?
So yeah, there are some reasons that we would have an increased risk of general anesthesia. If your dog has had any kind of side effects to general anesthesia in the past, so that would be a known hypersensitivity or risk, we would want you to make us aware of that, especially if it's not been in our hospital. If it has occurred here in our hospital, then we're going to make good notes about that and put alerts in their charts to know that there has been an anesthetic side effect. We want to make sure that there are certain dogs that have different risk factors, like sight hounds, which are bear greyhounds, have different risk factors than our like border collies that might have an MDR1 gene recession mutation. We also have our like Old English bulldogs with really smushy faces that would have more airway risk associated with general anesthesia. So we are mindful of those different risks that different breeds have, and if they've had anesthetic complications in the past, we want to know.
When is anesthesia not necessary?
So anesthesia would not be necessary if we did not need that dog to go under unconsciousness. We need to determine what is it that we want to do for that pet, and how much pain is it going to be inflicted upon that dog to determine if we need anesthesia or not. That's really our goal, and what we need to do is going to determine whether or not your dog needs to go under general anesthesia. Sometimes we can get away if it's an older dog with multiple health issues, we might be able to just give it a sedative and numb that area up and not be able to take your pet under general anesthesia because it's safer for them to do so. Other times we're absolutely never going to do that. For example, if we're doing any dental work, we're absolutely going to require them to go under general anesthesia because we cannot protect their airway unless they're intubated and they're under general anesthesia. So it really depends on our goals and whether or not anesthesia is indicated. But we're going to talk through that with you. So if you have any specific questions regarding your dog and anesthesia, whether it's needed, not needed, safety, how we do it here, what you can watch, we really just invite you to schedule an appointment with us and come in and see how we're different. Thank you.